recapitulating everything a little bit. First, come to the definition of ulcers. Discontinuity of skin, mucous membrane, or epithelial surface is known as basically ulcer. It is of two types. One thing is microscopic, another thing is macroscopic. In case of microscopic, there is a destruction of cell by cell or surface tissue. Usually we see it. But macroscopic, there is a total tissue death. In case of gangrene, where skin, bone, muscles, tendons, mucous membrane, everything got destroyed, destructed, and termed as gangrene. It is known as macroscopic, as because in our naked eye we can see the conditions, the cells, bones, everything is dead. Now we'll go for classification. In case of classification, first is non-specific. Non-specific term is non-specific. There is a traumatic. Traumatic means physical trauma. If there is an accident in the road, there is a physical trauma. Chemical trauma. Chemical trauma means suppose acid pouring and so on. It is chemical injury, and it is known as under it comes under traumatic classification. And there is a mechanical mechanical trauma, and it may also cause ulcers. Then there is a inflammation due to non-specific infections. We do not know, but different types of infection. Suppose tubercular ulcer, it is a specific type of inflammation due to acid fast bacilli of tuberculosis. But there are so many ulcers there. There is, we do not know, we do not cultured, but we can see that this is not tubercular, this is not syphilitic, but it is ulcer. Maybe there is a streptococcus, staphylococcus, and so on, and it causes inflammatory non-specific ulcer. Then there is ulcer due to nutritional deficiency. Nutritional deficiency means, suppose if you have protein deficiency, if you are suffering from chronic anemia, then what happens? Then neuritis or neural deficiency, then what happens? The nutrition to the cells does not go properly, and ultimately there is a formation of ulcer. Specific means infection, as I have told, tubercular, syphilitic, or any specific sort of infection. When it is there, then it is known as ulcer due to specific infection. And then internal cause, as I have just mentioned simply one thing, that peptic ulcer. Peptic ulcer is a ulcer due to internal cause, means there is a excess secretion of HCl due to more population of acinar cells, and it causes ulcers in stomach and first part of the duodenum. And another thing is, when there is a malignancy specifically on the skin, suppose malignant melanoma and other things are there, what happens? The skin becomes fulgurative, and ultimately there is a elevated open wound on the skin. Then it is known as ulcer, malignant ulcer. Then first is varicose ulcer. What we countered in our day-to-day practice, first thing is varicose ulcer. Varicose ulcer is very, very common in India, and it is due to loss of elasticity of veins, leads to improper drainage, stagnation of blood, and then hemolysis. And if there is hemolysis, there is hemosiderin deposition under the skin, which causes irritation of the skin, and there is a eczematous changes. And ultimately, if you do not treat, then there is a formation of ulcer. And if you do not treat the ulcer, then there may be calcification. It is the course of varicose ulcer in general. And why varicose ulcer is so common? All of you know that this is a tropical country, and mostly it is humid and hot. That's why it dilates, because heat means vasodilation. Cold means vasoconstriction. So varicose ulcers is very common in India. And as well as what happens, no, in our country, mostly the laborers and for different workers in different sectors, mostly they stand for a long time and ultimately develop varicose ulcer. Then there is a gangrenous ulcer. Due to arterial impairment, less circulation to the periphery leads to macroscopic death or gangrenous changes, which is known as gangrenous ulcer. Then there is a diabetic ulcer. All of we know that long-term diabetes mellitus leads to peripheral neuropathy, arteriosclerotic changes, improper nutrition, diminished cell growth, and as diabetic patients always prone to infection, and all these things leads to ulcer formation. Then tropic ulcer. Tropic is a general term. Tropic ulcer is due to nutritional deficiency, inadequate blood supply, nerve supply, known as perforating ulcers, seen in spina bifida, leprosy, diabetic neuropathy, etc. Bed sores. Bed sores, it is also a type of tropic ulcer, but the difference between the tropic ulcer and bed sore is that it develops and spreads with alarming rapidity even with every care. What sort of care you taking? But ultimately bed sores, mostly bed sores very rapidly spreads. Today you see one, next day you see two. In that way it develops, it moist, and ultimately it does not heal, and it causes generalized infection in immunocompromised patients who cannot move from his or her bed. Then rheumatic ulcer. Rheumatism causes chronic inflammatory process for a long time and leads to a ulcer formation in long run. Then just simply I am telling that Sastipokrama, Ayurvedic treatment for Sastipokrama for the treatment of ulcer. Branaka Sastipakram. Sastipakram means, all of we know that in case of Sastipakram, everything in Ayurveda, it has been documented as a Sastipakram. Ashtavidha Sastrakarma, Panchakarma, whatever it may be, Alep, Pralep, Pradeho, whatever. Everything comes under Sasti Upakrama. First, just I am mentioning that, then we will discuss later on. Then local factors for wound healing. What are the factors which promote or delays wound healing? First is Langer's disposition. If the wound is parallel to the Langer's line, then heals rapidly. But if it is not parallel to Langer's line, then it heals. It takes time to heal. Then there is infections. Presence of infection always delays wound healing. That's why mostly the modern doctors or everyone, all of we try to give antibiotics often to control the infection in a wound. Then vascularity. If there is no vascularity, though is suffering from less vascularity area, as for example varicose vein, varicose ulcer. Varicose ulcer, the common site of varicose ulcer is medial malleolus or lateral malleolus. And what happens, all of we know that just after the skin, the malleolus comes. There is no muscular support. As there is no muscular support, what happens? No, there is less blood supply because all the bones survives with less blood supply. That's why what happens, a very tiny varicose ulcer, we cannot, it takes a very long time for healing because there is a less vascularity around the malleolus. Then lymph drainage. Lymph drainage is necessary. Lymph drainage means there is a protein. If there is no protein, then there is no cell growth, and so on. So a proper lymph drainage is there. In case of sleepodo, but in case of filarial lymphedema, elephantiasis, what happens? There is a obstruction of limbs. That's why what happens? There is a formation of big ulcers. There is a big ulcers. There is a of big ulcers due to lymph obstruction. As there is a lymph obstruction, so there is a no proper nutrition to that area, and ultimately there is a formation of ulcers. And movements, if you move again and again, then it delays. We go for plasters in case of fractures, because of we immovable the fracture part. When it we make it immovable, then it heals rapidly. But if you don't immovable it, it will not heal. It will keep as it is. So movements is necessary. Non-movement, rest is necessary. Rest is better for early wound healing. And in these movements, I want to mention that how many what should be the gap to do the dressing. Because if you regularly dressing or twice in a day, it basically disturbed wound, and ultimately it delays healing. It comes after movements means the patient does not moves, but in that case, you as you are disturbing it, that means the wound is in not in rest. That's why dressing, how many days we what will be the proper gap in between two dressing, it is also very important. Then fixicity to the adjacent structure. If there is a fixicity to the adjacent structures, then what happens? No, then there is a wound contraction is not proper. All of you know that when a wound heals, first is wound contraction, then epithelialization, and then granulation tissue formation, and ultimately collagen synthesis. And wound contraction is so important in case of wound healing, because wound contraction, suppose a 4 centimeter of 4 centimeter of length of an radius of a wound. After wound contraction, it becomes one fourth of its original um, length. It becomes radius of 1 centimeter, which was 4 centimeter before. After wound contraction, it becomes 1 centimeter. That means you do not go for cell division, cell formation for 75%. Only 25% if you go for new cell development, it will be healed. It's a God's grace that the wound contraction is a major part of any sort of wound healing. That's why fixicity, if there is adjacent fixicity to the adjacent structures, what happens? The wound contraction is not proper. That's why there is a delays in wound healing. Then necrosis. Necrosis means almost death. When, as there is a necrosis, it will not heal, no. And the next one is foreign bodies. Foreign bodies are very, very important. If you put a healthy wound, two hairs on that wound, and you do dressing, the two small hairs will not allow to healing wound properly. So any sort of foreign body, specifically in case of street accidents, what happens? The different sorts of mud, stones are there implanted on that, and if you do not properly toileting it, never wound heals. Then systemic factors. All of we know, younger the age, better the wound healing. Nutrition. If nutrition is proper, cell formation is proper, anabolism is proper, and ultimately it heals rapidly. And all of we know that zinc jasad bhasma. Ayurveda is so mm, means brilliant. At that time they thought that zinc is necessary. Zinc is necessary for nucleotide formation. If there is no nucleotide phosphorylation, zinc is necessary. If there is no nucleotides, no DNA, no RNA, no cells. That's why zinc is necessary. All supplements, all modern supplements, food supplements, they use to mix zinc for proper phosphorylation, for proper protein synthesis. And all we know that jasad bhasma is used from for long time, for thousands of years in our shastra. And just I want to mention a thesis. When I was in Goa 16 17 years before, then from the pharmacy college of Goa, there is a teacher, Dr. Madhusudan Joshi. He studied a comparative study between the zinc supplement and jasad bhasma in wound healing, and he showed that jasad bhasma is 10 times more potent than zinc in the process of wound healing. Vitamin C basically delays wound healing. And hormones, androgynous hormone, estrogenic hormone, all these hormones are delays healing. Okay. Then just some pictures I am showing you. They who are in last class of antibiotics, this picture was there. This is in carbuncle, and carbuncle means it's a diabetic gangrene, Prameho pidaka, and it is always it mixed with different sort of infections, different sort of infection, gangrenous changes, and as well as um, gangrenous changes, as well as swelling, induration, pus formation, everything is there. And after treatment, uh, it is being almost towards healing, process of healing, as you are seeing that. Another part is this also I have shown in last class, a pyloradinar sinus. It has been operated in Chennai. I have forgotten, maybe Chennai Apollo or Chennai, I think, Vellore. But what happens, this is a personal of physiotherapist. He went for that pyloradinar sinus, but they cannot heal it. 6 months, after 6 months, 7 months of treatment of ours, now it has been healed properly. The the slide below. Okay. Then another thing, it's a rheumatic ulcer, as I have told last class also. Just rheumatic ulcer, and this is the healed. This is the healed part, rheumatic ulcer. Just I am later on I am discussing about prescriptions. Uh, uh, this is a varicose ulcer. Okay, and ultimately it heals. I hope you have understood. You are seeing the progress of wound, and ultimately it heals. Okay, then tropic ulcer. This is a tropic ulcer. A female of around 70 years old, and it is a special case. It has protein S deficiency. She is a wife of a uh, uh, military personnel, and in command hospital in Kolkata and everywhere, all the big hospitals. It has been She has been treated, and ultimately they has diagnosed that it is she is suffering from protein S deficiency, and never it will be healed. Never it will be healed. And you see that এটা বড় করা যাবে? You see that, you see the part this uh, সোচ্ছে না কেন? ওই, uh, 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 কি হলো? আচ্ছা, in that way you see the middle hills, two parts are there. This is then in that way see and heals, it heals, sorry, it just see healing is going on, healing is going, healing is going on, healing is going on, healing is going on, and ultimately it heals, ultimately it heals. Ultimately healed. Okay. The next one is, just see, it is a case of diabetic gangrene. It is a case of diabetic gangrene. You see that. Brother? That you see that the fifth toe has already been completely gangrened, and this is the lacerated wound. Here you can see that the middle part, it has been healed, and the blackish color has been diminished, and blackish color has been diminished, and slowly it is growing, the healing process is growing on, and at that time I think it is 2020, and ultimately this is the corona period, and ultimately the fifth toe, the just simply from the fifth toe, only fifth toe has been auto amputated, and the whole thing healed, whole thing healed, with a patient of uncontrolled diabetes. This is another tropic ulcer. You see that gangrene, all of we know that it is of, yeah, I am, can you hear me, no? Hello?
Yes, sir.
Yes, sir.
Yes, okay. Then what happens, no? In that, when this is a tropic ulcer, that blackish discoloration. This blackish discoloration as because it is some sort of gangrenous changes. We may told it dry gangrene, because gangrene is of two types: dry gangrene and moist gangrene. Dry gangrene we see in case of superficial gangrene. Basically, we see in case of older age. But moist gangrene, it is wet, it is rapid growing, it is very foul smelling, and we see in case of younger patients having diabetes. And this is also, you see that this sort of discoloration and so on, some sort of dry gangrene is there, and nutritional deficiency, varicosity is there, diabetes also there, and everything mix it up, and ultimately neuropathy is there, and ultimately there is a nutritional deficiency, and ultimately this sort of ulcer forms, and ultimately after treatment it becomes in that way. Another, this one, see this and this. This is a very important, this is a very important ulcer, basically in back, around the sacrum, L5, L4, L3, in that area. There is a there is a tumor which has been operated in modern hospital, and after operation she lost his sensation uh, in her lower limbs, and ultimately that type of ulcer was there. এটা একটু ছোট করতো, that type of ulcer is there. হ্যাঁ, and after dressing the students of uh, when where I am working, yeah, in the, you see that blackish discoloration ultimately goes off, and ultimately there is some sort of granulation tissue for source of granulation tissue formation. This red, this is granulation tissue formation, and then that, and that part of that, then this, then that, after and the size is diminishing gradually, and finally it has been healed. And after finally it has been healed, she got her sensation in the lower limbs. She can walk, she can do everything of work. She is a village woman, and she can, not only she can do his house everyday household work, but as well as the work out in field also, out, in the field also. I think Santosh Bharnekar is there. Hello, Dr. Santosh. Dr. Santosh. Hello. Hello. Okay. Hello. I want to share. When I was in Goa, no.
Hello, yes, sir.
Just I want to share
Hello,
something
yes, sir.
thing. Just I want to share that
Hello.
Mithun Bondre is
Yes,
there,
sir.
no?
Yes,
Your
sir.
Mithun Bondre is there, your classmate.
Yeah,
Now he's a teacher
I'm
in
listening.
Goa Ayurvedic College.
Yeah, I'm in
His
Goa.
uncle,
Yeah.
elder brother of
Yeah.
his father, got an accident in the age of 27
Classmate,
years.
my classmate.
When he
Yes,
was
yes.
27 years, I think you know that. And 27, when she was 27 years
Huh.
old, he was
Huh.
27 years old. There is a street accident, and ultimately he has lost his sensation of the lower limbs, and there is no erection of penis, and there is a, there is a big ulcer in the lumbar area, lumbosacral area. And when I was there, when I go for treatment, I think 2005 or 2004, that the famous Goan dam is there, no? Okay, what is the name? I have forgotten. Goan dam,
Okay, okay.
and adjacent to the village of Mithun. And ultimately, we went there, and it has been treated with Ayurvedic medicines and so on. And in course of time, and there is a multiple fistula, as there is no sensation, no, there is a multiple fistula in the gluteal region. And what happens after treatment, within 6 months, completely for 25 years, a patient is bedridden. You can imagine the sufferings of his family members, of him, everything. And within 6 months, from bed, he can ওই চলন্ত এগুলো কি বলে, রিক্সাগুলোকে যেগুলোতে বসে, আরে চেয়ার, হ্যাঁ, হুইল চেয়ার. And in after 6 months, he can, from bed he can, on his own he can sit on the wheelchair and go for this room to that room, this room to that room. And within 1 year, he can walk to the bathroom, and erection, the fistula, everything has been healed. When there is a sensation is there, no, when there is a when the deficiency of nerve sensation, he has got the nerve sensation, everything healed. I think it is a very good success 20 years or 20, 18 years before in Goa. হচ্ছে না কেন? এই,
What happened? What's that?
Finally, okay. Then we will discuss some things. না, after finally তো না, তারপর থ্যাংক ইউ পরে আরো কিছু আছে।
উপরে prescription আছে।
Now we'll go for prescriptions. Now we'll go for prescriptions. First is prescription of varicose ulcer. Varicose ulcer, you see, Kamdudha, 250 milligram, 1 pill BDSC. Giloy Satta, 250 milligram, 1 dose BDSC along with 2 drops of honey. Guruchadi Loho or Punarnava Mundur, 1 pill TDS, 250 milligram. Guruchadi oil for application from down to upwards twice a day. And 5, dressing with Guruchi oil. 6, avoid long standing, use stockings and so on, all of we know. But one thing, this is one thing I want to mention it, all the medicines basically made of Guruji, made of Tinospora corifolia. And as for my practice, what I have realized that any sort of vascular disease, maybe arterial impairment, maybe it is varicose ulcer, whatever it may be, the product of the drugs containing Guruchi, Tinospora corifolia, it is very, very much useful. Very, very much useful. In case of varicose vein, in case of varicose vein, if you prescribe these medicines only, nothing to be done, you will see that it will get effect within 2 months, 3 months. The swelling of the varicose vein, it will come down. Ultimately, you see he or she feels better in walking and so on. There is a little pain. And one thing I want to mention, that in case of Guruchadi Loho, instead of Guruchadi Loho, I have also prescribed Punarnava Mandur. Punarnava Mandur I have written because of Punarnava Mandur is Mutrala. It is diuretics, and it will cause diminishing swelling. And diminishing swelling means there is a early process of healing of ulcers. Just remember, according to the conditions, you have to change your prescription. But if it is a varicose ulcer, then you may go for it. Then এটা কি রে, এটা কোনটা দেখতে পাচ্ছি? Prescription of diabetic ulcer. Diabetic ulcer, all of we know diabetic ulcer. So we have to treat diabetes first. Okay, Argavardhani is an anti-diabetic drug. Giloy Satta Guruchi is anti-diabetic. Navayas Loho, it is anti-diabetic. Punarnava Mandur, as I have told, it will minimize swelling. That's why if you don't go for Punarnava Loho, you may go for Punarnava Mandur according to conditions. If the patient's ulcer part is more swelled, okay, then we should go for Punarnava Mandur, Bangeshwar and so on. Okay, and Guruchadi Tel and honey for dressing. Guruchadi Tel and honey for dressing. And Basanta Kusumakar Gold, it is also, all of you know, that oral hypoglycemic, and we may go for that. And Somnath Ross, all of you know that it is anti-diabetic drug, and that's why it has been prescribed. But remember, these things, according to the blood sugar level, we should change these things. And why it is Guruchadi Tel? because when I joined as a teacher in 2003, means as far my knowledge, all over India, for healing purpose, for dressing purpose, only Jatadi oil has been used. Jatadi oil or Jatadi ghrita, mostly 90, in case of 90%. But in course of time, when I joined as a teacher, I have in my mind that I have to develop oil also, others oils also, because suppose after 10 years or 5 years of teaching, if only Jatadi oil I am using, it is not good for fraternity. That's why I have tried guruchadi oil বা guruchi oil at that time for antiseptic dressing, and it make me astonished. It make me astonished that it delays amputation. It controls ketoacidosis, severe smell. They who have seen the diabetic wound know. The ketones, the smell of ketones, you cannot go for dressing properly. In case of modern doctors, what they used to do, they go for insulin, they rapidly they control diabetes and go for amputation. But against all these things, guruchadi oil is a very very good drug. If you go for pichu of guruchadi oil over the wound, no, the, you will not smell the bad odor of ketones. And you have to control with these medicines diabetes. You all need to diabetes. No, the Santosh Bhernekar, Dr. Santosh Bhernekar, no, because in case they are he is no more now. They part of management in Goa. He is suffering. He is suffering from long term uncontrolled diabetes, and they go for amputation of his great toe. I think left or right, whatever it may be. So at that time the sugar is high. So modern doctors I told him they first control the diabetes first, and then we'll go for um, amputation. And I am he was accompanied with me, and when the modern doctors, I think Santosh Bhandekar, no, Dr. V.V. Kamath, one of the leading surgeon of Goa, just simply he has asked me that, do you have any medicines or do you have anything you can do anything? Then I have told I had, but then you try. Huh? And after 7 to 8 days, at that time, whatever prescription has been given for controlling diabetes, as well as I have also given something for these drugs, these anti-diabetic drugs which are mentioned in Ayurveda, and as well as simply throughout the day and night, 24 hours, it is poured in guruchadi oil. And after, I think, as far I remember, when you go for amputation, no, 7 or 8 days, after 1.5 hours, he came back and told the doctor has told that no need of amputation now. You, whatever you are doing, you continue. And I was there in 5.5 years in Goa, but amputation does not happen in that case. So always keep in your our ancestors. They are so brilliant, so honest. Whatever they have written, no, it is used. It is useful, but please prescribe it. What I am telling, please prescribe it, and it will give you the dramatic result to you. Dramatic result to you. I have shared last class. You have seen that HB1C, which is 12.4, it comes down to 7.1. and the latest report I had 2 or 3 days before, it is come down to 6. A uncontrolled diabetes with insulin dependent, insulin resistance diabetes, who has who has been admitted to the ICU. Ultimately, they are not so healthy to continue in the ICU, and they came back, and accidentally they admitted in our hospital with 12.4 HbA1c, and ultimately now she is 6 HbA1c with simple medicines. Insulin has been stopped. So what I am telling you, just simply prescribe. If you prescribe, then everything possible in our case. Then prescription of rheumatic ulcer. Prescription rheumatic ulcer, for rheumatism, for Vata, we have to go for some medicines. I prefer Lakshmi Vilas. Lakshmi Vilas is a very, very good drug. Lakshmi Vilas is a very, very good drug. I used Malla Sindur. I used Navayas Loha. Loha in every sort of ulcers. Loha should be there. Loha should be there because of Loha is rasayan and nutrition, and it gives nutrition to the body, and it affects healing. If it controls anemia, means if it controls malnutrition, and obviously it will heal. So in every prescription, Loha should be there. Loha Mandur should be there. Otherwise, the prescription is incomplete as for my knowledge. As for my knowledge. Then I have forgotten to discuss about honey. Honey, no, honey always, if you apply honey, it is so lecconio, it controls every sort of infection, Okay, then you may ask that Jatadi tel is there, Nimbadi oil is there, Guruchadi oil is there. What sort of oil we should use it? What I am telling, no, suppose the ulcer is infected, then go for honey and guruchi oil, mix it up with equal quantity and make it paste and apply over it. Within 3-4 days it will be cleared, completely cleared. Okay, completely clear. But if it is a fresh wound, there is no infection, though there is no eoless discoloration, एकदम simple fresh wound, then stop honey and go for simply guruchi tel, simply nimbadi tel, and so on. But if there is some sort of infection is there, and as well as granulation tissue, formation of granulation tissue also there, then you go for Jatadi oil. Because Jatadi oil, it has lecconio property, Jatipatra, it has lecconio as well as roponio. That's why you may go for it. Okay, but in case of fresh wound, Guruchi oil, Neem oil, as per your knowledge. But one thing you have to remember, in case of rainy season, we should avoid oil. It is better to go for Ghrita. Okay, then it will give you better result. Then the other drugs, as I have mentioned here, Brihat Bat Chintamani, Bata Vidhangsi, and dressing with erandotel. Erandotel is also very, very good. Very, very good. As there is no infection, no infection. No infection. Then erandotel is very good. That the tumor, the loss of sensation. Last slide I have shown you. In that case, lastly I have dressed with this one. Lastly, I dressed with erand oil. It gives lastly very rapid result to me. Very rapid result. Very rapid result to me. And I have just Jasad Bhasma. Maybe I forgot. That's why I have mentioned here Jasad Bhasma. As I have told earlier, that Jasad Bhasma is a very, very important part of wound healing, because it Without Jasad Bhasma, there is no cell formation. So Jasad Bhasma is must giving medicines. I mix it with some medicines, but otherwise Jasad Bhasma with 2 drops of honey, whatever it may be, we should give it systematically. Systemic application. Then there is a prescription of gangrenous ulcer. Gangrenous ulcer means gangrenous ulcer means mostly it is diabetic. Without diabetes, gangrene cannot form. Without diabetes, gangrene cannot form. So that means it is a just almost carbon copy of prescription of diabetic ulcer. One thing I have changed here, Brihad Bangeshwar, it is also anti-diabetic and diuretics, and Mahalakshmi Vilas. Mahalakshmi Vilas is a very, very good drug. Any sort of Srotavarod, any sort of arthrosclerotic changes, if you go for Mahalakshmi Vilas, it gives you very good result. Even just simply I am telling you, if there is a fimbrial block in fallopian tube, you go for Mahalakshmi Vilas. If you done HSG, HCG, HSG, and after 1 month of application of simply Mahalakshmi Vilas, nothing to be given. Simply Mahalakshmi Vilas you give, and after 1 month you go for HSG. Fimbrial block will be not there. I am assuring you. I am assuring you. And another thing is that what I have given in case of Mithun Bondrej's case in Goa, and till I am practicing it. The arterial impediment means towards periphery there is a obstruction, and in case just opposite to the varicose ulcer, varicose vein, where improper drainage of blood from the periphery towards heart. And in case of arterial impairment, in case of gangrenous changes, what happens? The blood does not comes to the periphery. Okay, then the 3 methods are there in modern books. It is very, very useful, very, very useful. What is first is reflex method. Reflex method what? Suppose if you have a gangrenous change, you have an wound due to arterial impairment in right leg, you put the left leg, healthy leg, on warm water for few minutes. Then warm water means there is a vasodilatation. When there is a vasodilatation, then in reflex to that, vasodilatation will also occur in the leg where wound exists. And when there is a vasodilatation, then there is a thrombus in the artery which obstruct blood to flow the blood to the end of the periphery. It comes down, or it change its position. Then to some extent there is a flow of blood and vascularity occurs. So it is a very, very non-invasive, very economic method for vasodilatation or relief from the obstruction due to thrombus. Then there is a Barjat position. Barjat position means tell the patient to sit in the to sit on his bed and put the leg down. What we do in case of varicose ulcer, we put the legs up over the pillow and so on. But in that case, you have to put the leg over below the bed. Okay, and in that case, what will happen? No, the blood from the heart, it comes down and obstruct over the thrombus, and it create pressure over the thrombus, and due to that pressure, the thrombus may change its position, may split into different parts, and ultimately it helps in blood flow, it helps in vascularity. Then there is a Burger's exercise. This Burger's exercise means, Burger's exercise, what happens in case of Burger's exercise, we go for, we tell the patient just up and down to make the legs up and down, up and down. In this exercise for 5 minutes for 3 times in a day, and it helps. It also helps to change the position of the thrombus to relief from the obstruction, and ultimately it also helps in flow of blood to the diseased or ulcer part, and ultimately all these things helps in wound healing, helps in wound healing. ষষ্ঠী পক্ষ মনে বের করতে হবে। And one thing I want to share with you, leech application in callus ulcer. What are callus ulcer are? Callus ulcer are you do dressing every day, there is no smell of foul smell, there is no secretion, but they are pale, they are not pinkish red, they are pale, means they does not respond to your treatment. It is known as callus ulcer. Neither it is growing on, and neither it is smaller in size in course of time. It is known as callus ulcer. I have seen that if you apply Jaloka nearby or anywhere, because Jaloka, basically we should go for Jaloka for systemic use. It has little use for it is little use as a regional part. Okay. So if you go for Jaloka application, 3 to 5 days, 1 or 2 Jaloka, 3 to 5 days, I have seen the callus ulcer shows its healing. It is very much useful, as I have seen. Now I want to discuss about the use of Sasti Upakrama. Sasti Upakram Chedan, we can do it. We can do it in our chamber. In OPD level, in casualty room, we may go for Chedan, we may go for Vedan, we may go for Esan, if foreign body is there or not. We Aharon, all of you know that Aharon we have to remove the foreign body and so on. Everything we can, Ashtabhita Shastra Karma, we can do it with little infrastructure. But suppose Baman, if we want to go for Baman in a case of ulcer, in this first life, is patient have time? Does patient have money? Or does we have infrastructure? We generally don't have. But all these things, if we, as per necessity, if we use all these Sasti Upakrama in case of in ulcer healing, obviously it will heal. What sort of ulcer it may be? I have dressed malignant ulcer, I have dressed varicose ulcers, I have dressed amputated. It has been amputated, and the amputated part has been open, raw surface. The skin they have grafted, it has not worked, and ultimately the patient is coming to us with having a raw surface amputated leg. In that case also it has been healed. And every sort of, whatever you may think, gangrene, whatever, it has been healed with healed with Ayurvedic medicines only. All of which they who know me All of you know that I don't use any sort of modern medicine, any sort of preparatory medicines. Never means in the first time in our life I have used, but last 10 to 12 years I have not used any sort of preparatory medicines, any sort of modern medicine, any sort of antibiotics to treat the ulcer. Just I want to share, because I am telling in that way, no, I am telling in that way that Ayurveda shown me that what it is, what it is. I know this patient, no, this patient, around 16 years of ulcer, dressing. The unmarried women of 56, 57, 58 years old, very, very miserable life. Uh, and then when he asked me to treat the patient, he asked me that, is it curable? Modern doctors are told that never it will heal. Before telling that, no, it will heal. But till I had some sort of confusion, some sort of less confidence. Is it heal or not? But Ayurveda shows it has been healed. Ayurveda shows it has been healed. That much I want to share. And suppose, I'm telling you, suppose Birechan. What is the role of Birechan in case of ulcer healing? In case of ulcer healing, simply because what Birechan means loss of fluid. Birechan means Pitta Nasa. Pitta Nasan means it lays acidosis. It changes pH. Okay, from acidic to normal range, from 7.36 to, try to maintain the pH of blood 7.36 to 7.44. Okay, Birechan. It minimize swelling. It minimize swelling means it promotes healing. Every sort of whatever in Sastipokram, whatever written in Sastipokram, everything is useful in wound healing. If one does not work, you use two, you use three, you use four. And not only that, after healing, they are trying that suppose the granulation tissue is not forming properly. Okay, then they are telling that there is a gap, there is a down less feeling of wound. Then they used to say that you go for Jastimadhu Kalka, Tila Kalka for wound healing. It is a very, very good healing effect of ulcer healing in Jastimadhu. And as well as suppose it is the proper epithelialization is not there, and ultimately what happens, granulation grows toward upwards the level of the skins as a cauliflower. Then they are telling that you use cassis, and I used cassis, and you see this case Dr. Subhendu know everything, you know that after cassis, no, how good it is, almost heals like normal, Okay, so Vikrita Paho, deformity is there. After healing, some sort of deformity will be there. It should be as far as practicable, as far as possible, we have to make it tends to normal. So all sort of 60 upakramas in our OPD level, and they who have in our OPD level, we go for it and never use antibiotics. I am telling you, I am requesting you, all of you, never use antibiotics. As they who have attended my class, last class, no, if you feel less confidence about Ayurvedic antibiotics, you use it. If it does not work, no, just simply call me. What happens, no? What happens, just today I have experienced that a patient, my colleague's patient, he has creatinine is 10 point, I think 3, or creatinine 10.3. Okay, 10.3. So as I am a little, I have patients of chronic renal failure. So he has told me that please advise me to how to prescribe this case handles. I have prescribed. After prescription, after 7 days, when we go for salt restriction, protein restriction, potassium restriction, everything has been done. Okay, everything has been done, and after 7 days, we go for blood evaluation. We see the creatinine is 13.1 within 7 days. I astonished. Okay, one of my colleague asked for advice, and ultimately 10 to 13.6. Then I go for prescription. Then what happens? No, junior doctors, he complained that I have some sort of constipation. Then he has prescribed Birichan full of salts. So all these things, everything, every tiny things we have to remember. We have to keep in our mind and go for a prescription. Prescription is not so easy, but if you do Ayurvedic prescription, it will give you result. I know that I joined in 24th January 2003 in Goa, and at that time my previous colleague left me a Burgess disease in Goa. And Burgess disease after Google Dhupan, after Trifalakat Dhawan, without antibiotics, I have seen that it has been healed. So in case of wound, if Ayurveda cannot heal an ulcer, no one can do it. No one can do it. I am assuring you. If we can't, no one can. I think almost I have, in a nutshell, I have told you everything. Just I am opening for 10 to 15 minutes for any sort of questions. মাইকটা বন্ধ করো আমার। You don't have any questions? Hello? Hello, Apradeep. Yes. Apradeep.
Yes, sir. Sir, please, can you tell me what can I use as use as treatment for cancerous ulcers,
What?
malignant or for cancerous ulcer? So, sir, what is the treatment for malignant or cancerous ulcers?
Cancer ulcer. Malignant or cancer ulcer? It's a very genuine question. I have not here mentioned malignant ulcer. Malignant is very different. Malignant means we have to go for Vidrodhi Chikitsa. Vidrodhi Chikitsa, but dressing should be done with these medicines only. Treat the malignancy and do the dressing in that way. Guruchi oil, whatever it may be. Okay. And one thing Dr. Abradeep, I can make you, understand, no? Treat the
Yes, sir.
malignancy,
Yes, sir.
in different way, and treat the ulcer in this way. Okay. And one thing I have forgotten to tell you, that you may ask that what is in case of tubercular ulcer, in case of syphilitic ulcer, in that way. I have left it because syphilis is not so common nowadays. In my lifetime, I have not seen any syphilitic ulcer, but I have got tubercular ulcer. But it is national program. It is acid first bacilli, so we have to go for that anti-tubercular drugs. Anti-tubercular drugs and dressing you may do with these medicines, but anti-tubercular drugs should be given to them. I have forgotten the things I have to mention. Any question more? Any more questions is there? Anyone?
Sir, in
Ah,
case of cut injury, suppose the cut is very wide and wound is opening, then what should you go for neem oil or jattari oil for dressing purpose?
anyone can choose. Suppose it's a cut injury. If it does not come to you within 6 hours, you cannot go for
Hmm.
stitch. We have to
Hmm.
go for dressing with these oils only. And each oil works. No problem. Each oil works.
Okay, sir.
Okay.
Sir, when we go for honey,
When you go for honey, when there is infection, severe
okay,
infection, when it is diabetic, then go for honey, and it will give you result. It's an malignant ulcer. Go for honey. Foul smell is there. Just apply 2 days only honey. 2 days, the wound will be fresh. There is
sir,
no smelling. There is source of granulation tissue. Yes. Anything
sir,
else?
my abscess was completely healed within 3 to 4 days uh,
And,
by using tonkon and honey.
Tankan and honey. What I am telling you, I've understood. No.
Hmm.
So everything heals, but read Ayurveda, write Ayurveda, and speaks for Ayurveda, promote Ayurveda. It will give you the best return in your life. Okay? Anyone else? Anyone
Hello,
else?
good evening, sir. Hello, sir.
Hello, hello.
Hello.
Apradip. Yes, tell.
Yes, sir. My question is that the mode of dressing in dressing of malignant ulcer will come under which category? The varicose ulcer, diabetic ulcer, rheumatic ulcer, or gangrenous ulcer? So the mode of dressing of malignant ulcer.
Mode of malignancy, you may go for trophic ulcer or rheumatic ulcer, you may think. Rheumatic ulcer, you may think. Okay? Rheumatic ulcer, you may think.
Thank you, sir. Thank you, sir. Sir,
Uh,
sir,
yes.
and one more question. Sir, which type shall we use ghee?
Ghee, yes. Ghee is also
Sir,
very useful.
which type of ulcer shall we use?
As I have told, in case of rainy season, every ghee is a medium. Ghee is a medium, but honey in case of ulcer is a medicine. As oil is a medium. We are using guruchi oil, nimbadi oil. Oil is a medium. As well as ghee also is a medium, except barnund. In case of barnund only, we may go for ghrito, satadhauta ghrito. Otherwise, in other wound, in case of rainy season, we go for jatadi ghrito, nimbadi ghrito, guruchadi ghrito, whatever you like. Okay, and one thing I have forgotten, Pradeep has rightly asked me that in case of burn wound, burn wound, burn wound, one of my student in hostel, there is a burn on his hand, and we generally use mostly what people are used to prescribe silver sulfadazine and so on, but nano silver. The things are there, but you simply we used to use एरंडत ऑयल एंड मधु इन सम मात्रा में. एरंड तेल मधु लगाओ, within 5 days it heals. Within 5 days. Ghृत Kumari is there. Application of Ghृत Kumari instantly minimize the burning sensation. Minimize burning sensation. And for dressing, you used erando tel and honey. Very, very good effect. Very, very, but samamatra. Madhu should not be more. Madhu should not be more. And all of we know that madhu is anusna. Madhu usna nahi hai. Madhu is anusna. Always remember it before dressing. Okay, no? If you use for erandotel and honey, it gives you dramatic result. And ultimately, Satadhauta Ghrita is there. And in our Bengal Gharana, there is a medicine known as Baharer Nani. It is very much useful in case of burn. We used to use it in case of burning sensation in anal fissure, but it is also very much useful in case of burn. Okay, any more question?
Sir, when we look for Yasat Bhasma,
Every time we should go for Jasad Bhasma. Jasad Bhasma as a food supplement, as medicine, whatever it may be, it should be enter in the patient's body.
okay, sir.
Okay. Anyone else? हाँ. कितना कितना इसमें हम लोग बोलेंगे जो सुपरफिशियल बार्न में तुम आराम से यू मे इन सुपरफिशियल बार्न यू यूज madhu and eranda oil. When there is a blister formation, no, if you just simply prick the blisters and it goes off, you simply remove the over the skin and you go for endothelial madhu, it works. But in case of deep burn, avoid madhu. You go for eranda oil only. It gives you better result. Otherwise, Satadhauta Ghrita is there. You may use also the paste of Kalka of Ghृत Kumari. Ghृत Kumari English টার নামটা ভুলে গেছি. Aloe vera. Okay. Hello. Anything else? Okay, then we can conclude this session.
হ্যালো স্যার।
Hello. আর কেউ আছে বোধহয়? Anyone?
স্যার
Hello.
can
हाँ, yes.
sir can we
Sattam Beura.
sorry for
Are you
disturbing?
from?
Yes sir, yes.
Are you from?
Sir I'm from Odisha.
Odisha. हाँ, ମୁଁ ଓଡ଼ିଆ
Odisha.
କହିପାରିବି. କହନ୍ତୁ କ'ଣ କହୁଛ?
ଆଜ୍ଞା ସାର୍ ନମସ୍କାର ସାର୍।
ନମସ୍କାର, କହନ୍ତୁ.
ସାର୍ ଆପଣଙ୍କ ସେଠି ନମ୍ବର ମିଳିଥିଲେ ସାର୍, ମାନେ ଆଗକୁ ସାର୍ କେସ୍ ଗୁଡ଼ା କେସ୍ ମାନେ କିଛି ଡାଉଟ୍ ଥିଲେ ଆପଣ ତ କଣ୍ଟାକ୍ଟ କରିଥାନ୍ତି ସାର୍।
ଶୁଣ, କଣ୍ଟାକ୍ଟ କରିବ ନା, ମୁଁ ପାଗଳ ହେଇଯିବି। କଥାରେ ବି ବୁଝିଲେ ନା?
ସାର୍ ନହେଲେ ସାର୍
ନାଇଁ, ମୁଁ
ସାର୍
କ'ଣ
ନହେଲେ
କହୁଛି, ଆମ ଏଇ ଯେ ଗ୍ରୁପଟା ତୟାର କରି ହେଇଛି ନା, ତମର କ'ଣ କ୍ୱେଶ୍ଚନ
ଆଜ୍ଞା
ରହିବ
ସାର୍
ତମେ ସେଠି ପୁଟ୍ କରିବ. ମୁଁ
ଆଜ୍ଞା ସାର୍ ଆଜ୍ଞା
according to my time I will obviously I will answer you.
ଆଜ୍ଞା ସାର୍ ଆଜ୍ଞା
What I am telling you understood, no?
ଆଜ୍ଞା ସାର୍।
You have done your UG from which college?
ସାର୍ I am in final year.
Huh? No, no.
I am
Final
his
year.
final
Which
year.
in which college?
Government Ayurveda Medical College, Balangir.
Bolangir. You are from Bolangir, no? I have done my
Ayan,
PG
sir.
from Puri.
Ayan, sir.
What I am telling you understood, no? And in Bolangir,
Ayan, sir.
There are also my friends are there in Bolangir and Baharampur, everywhere. My teachers are also
ଗୋପବନ୍ଧୁ ଆୟୁର୍ବେଦ ମହାବିଦ୍ୟାଳୟ
Gopabandhu
ଗୋପବନ୍ଧୁ ଆୟୁର୍ବେଦ
Mahavidya.
ଏଇ ଯୋଉ ମନ୍ଦିର ପାଖରେ ଅଛି।
Mandir Pakhar achi. What I am telling you, no?
ଆଜ୍ଞା
Whatever
ସାର୍
you have confusion,
ଆଜ୍ଞା ସାର୍
you simply put the question.
ଆଜ୍ଞା ସାର୍
I am trying to do the series of webinar for
ଆଜ୍ଞା ସାର୍
common practice. For common
ଆଜ୍ଞା
practice. Okay, no. Then ultimately,
ଆଜ୍ଞା
suppose 10 or 20 disease what used to come to us. If we confident on those, no, then we
ଆଜ୍ଞା
can go for practice, full-fledged Ayurvedic practice. That's my
ଆଜ୍ଞା
motto.
ସାର୍
That's why I am trying to go for webinar. Okay, and
ଆଜ୍ଞା
I
ସାର୍
am later on I will give these what disease I will do. You complete the course. I think you will feel confident, and after that we will give a big group all over India. We are trying, and we will promote Ayurvedic practice in completely Ayurvedic way.
ଆଜ୍ଞା ସାର୍
Okay, namaskar, namaskar.
ନମସ୍କାର ସାର୍ ଜୟ
Namaskar.
ଜଗନ୍ନାଥ ସାର୍।
Okay, jai jai. Okay, okay, bye. All good?
Sir, I have one more question.
Yes.
Sir, in case of ulcer dressing, there are some slab formation and granulation tissue with both. Then what should we go? Matlab,
You should regularly. You
can
should go
we
for cleaning.
eradicate
Cleaning
the
it.
slab completely?
No, no, no.
Matlab,
Not always. Not always. Without stretching, as
okay,
far
sir.
as practicable, go for it.
Okay,
Don't forcefully. Don't remove it
okay,
because it hampers its rest. As I have mentioned, no rest is immovable mobility done. If you go for stretching, no, then it becomes movable. When it becomes movable, it will delay.
okay. That
Okay.
means naturally granulation tissue will be formed.
Formation ultimately the unhealthy granulation tissue will falls off.
Okay,
Little
sir.
bit we have to go for intervention.
Okay,
Mostly
sir.
no massive intervention needed. Anyone else?
Sir, my question is that how can we maintain the pH of blood without the use of Birechon?
Without the use of Birichan, how can we maintain the then
pH of blood.
pH of blood? Then we have to go for without maintaining Birichan, we should go for respiratory alkalosis, Kapalbhati, and so on. What happens? No, then more oxygenation in there and more carbon dioxide to be removed from our body. Automatically, pH will be maintained without Birichan, without medicine.
So my doubt was that how can we maintain ketoacidosis by only the use of medicine only?
Ketoacidosis, so
pH and
you can use
pH
it
and
medicines also, no? All antibiotic drugs, all anti-diabetic drugs, all oral hyperglycemics, or all promeonasal drugs are to some extent minimize acidosis. To maintain, simply you go for Arogavardhani only. You go for Arogavardhani. It will come down your acidosis. Okay.
Thank you. Okay, sir.
Okay.
Thank you, sir.
Okay, welcome. Bye. So, Subhendu, we may conclude now. Any question? And one thing I have to ask that how do you feel this webinar? It is okay, or in the area of I am asking you. I am not so good in these things, so I am asking you, anyone, that how I can improve it. The quality of presentation. Anyone? You may put. You may share in the group also. Okay. Okay, I'll come back. Okay. 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 I'll come back. Okay.